All right. Good afternoon, everybody. Yours truly, Dr. Barry. Of course, because when we go live, we're going to give about a minute or so for, it to spread out for YouTube to open up and Facebook to open up and people to join before we kind of do our introduction. But of course, the big discussion, especially unless you're under a rock, is the coronavirus. And if you're a part of my Facebook group, we've kind of talked about this kind of briefly over the past couple of weeks. But with just the amount of information that's kind of been coming out on a day-to-day, really hour-by-hour basis, I really felt it was very important to talk about this virus, especially obviously in the medical sense, but really in the public health sense as well, right? Because it is definitely something that unfortunately is here to stay, right? Like it's definitely not something that's going away, right? It's not something that we're going to be able to just kind of brush off and keep moving. So let me just give me a second, make sure that is going. All right, perfect. Okay, so what are we going to talk about on today's video? Obviously, we're going to talk about what is the coronavirus. Again, unless you've been sleeping under a rock, you probably already know what it is. We're going to be talking about kind of signs and symptoms, who gets it, where it came from, and most importantly, I think what's really driving home a lot of the kind of the concern and Costco and all these other places being bought out is this onus from a public health standpoint. Like, what do we really have to worry about, right? So it's about, we're gonna get about 15 more seconds. That's about 2 minutes for people who are going to be on and catch up. I'm actually going to go ahead and share this to, because I'm actually streaming live on both Facebook as well as YouTube. So I'm going to go ahead and share it on my personal page as well, just so everyone's kind of caught up. Sharing the group. All right, so that is said and done. So all the introductions, right? Let me get the introductions out of the way. I am Dr. Barry Pierre, board certified internist, founder of drbarrypierre.com, as well as I am program director, internal medicine program director, director of medical education. I'm a doctor in osteopathic medicine, as well as a master's in public health degree, right? So when I talk about a disease process like the coronavirus, COVID-19, this is something that I have to really kind of wear two hats in discussion. The reason being is that it is unfortunate, especially I'm here in the United States, depending on where you're watching this, right? This is a disease process that's going to affect a lot of people. And unfortunately, because of the way our media and the way our TV kind of runs, people are frantic, right? And rightfully so, right? Because they're very, very concerned of, kind of what's going on and, really what they can do about it, right? Again, they're buying out toilet paper. I know my wife, she can't even find hand soap and hand sanitizer now because that seems to be like sold out everywhere, right? So really the goal, especially here, is to kind of speak from a medical and public health degree, really to try to I don't want to say, hopefully calm some fears, but most importantly, kind of educate and, make us prepared of what's to come, right? And by I say what's to come, like this is not something that's going to be here for like the next couple of months and then just kind of die out, right? Like, unfortunately, especially in the first kind of stages, this is something that's going to kind of ride out for a while for that standpoint there. So I think first and foremost, let's start out, obviously right from the beginning, like what is the coronavirus, right? So this is, and for those, just for full disclosure, because I realize just kind of just talking to people and not realizing, I don't think a lot of people kind of understand what the coronavirus is. I think a lot of people think that this is kind of the first time we've ever heard of this term, but pretty sure right? If you heard of the SARS virus, right? And that's something that kind of, I think it was 2016, right, or 2014. I'm not sure when it actually like really came up. The coronavirus, COVID-19, is in that same family, right? So no, this is not the first time we are experiencing this type of disease, but this is the first time that we've experienced it on such a global scale. And we'll talk about it later as far as like the evidence of what it means as far as a global scale. So this is a virus that, again, a lot of this specific one that we're talking about, COVID-19, yes, it did originate, or kind of really the case it started originating from China, but it is not. And I hope if you don't get anything from this video, or I hope we can get that point, this is not a virus that like came from China, right? Like I see that said multiple times, and that's like so inaccurate and low key racist, high key racist. So it's not this virus that came from China. That's not the case. This virus has been here. Like I said, if you know SARS, if you heard of SARS, you've heard of the family of the coronavirus, because SARS is in that same family. COVID-19, again, and I saw someone say, why is it called COVID-19? Well, this is not a virus that just happened like this past year, right? Like, again, we've kind of knew of these cases since 2019 up until now. Unfortunately, now in March, depending on when you're watching this is a global pandemic, right? And we'll talk about the significance of it being really a global pandemic. The coronavirus, just in general, is really a virus that was primarily kind of transferred via animals, right? Especially this specific one, primarily via animals, but for some reason, right, it's made to jump, right? And unfortunately, that's how viruses, bacteria, like they just, they made to jump, and humans are affected, right? So once we get to the point where humans are affected, what should we be concerned about? And you heard some people kind of talk about the coronavirus and the flu kind of in that same kind of ilk, some same kind of sentence. And it is different for a lot of different reasons, right? But for the signs and symptoms, I think that's where they're kind of trying to draw some similarities, because the coronavirus really does affect the upper respiratory system, right? Before it affects everything else, right? It affects causes shortness of breath, causes cold, wheezing, chest tightness, causes all these things that kind of happen up here, right, in the upper respiratory system, and causes those signs and symptoms of concern, headache, sneezing, runny nose, all the things that the typical common cold, right, or even the flu will cause. So that's why you're seeing a lot of people kind of reference the coronavirus and the flu kind of in the same sense, even though, again, it's not the same. It just kind of presents in that same fashion. But what happens here with the coronavirus is that, again, the same incubation period, about a couple of weeks, right? So you have people who are going to be walking around with the coronavirus for a couple of weeks before they even know it, before they even feel any symptoms. But unfortunately, because they're walking around with that whole time, their ability to spread it out occurs, right? So and of course, that's always a problem when you're dealing with these types of diseases, because if you know that just having the disease is enough, right, to spread it out, but I don't even feel symptomatic from it, how can you really protect yourself? Which is why you see kind of this overreaction that we're having now, where, again, you can't buy toilet paper, hand soap, like, you can't buy all these things here. So typically symptoms of fatigue, fever, headaches, cough, some production, shortness of breath, some muscle aches and pain. Like I said, if this sounds familiar, it's because this is a lot of the same symptoms that are associated when someone gets the flu. But here, what's the biggest issue that's occurred here is the rate of people getting sick, and even more deathly sick, right? Again, if this is your first time seeing me, I'll tell you right now, I'm a big flu vaccine proponent, right? Reason why is because as a hospitalist, I take care of a lot of patients who deal with the end stage effects of the flu. Most of the time, especially for people who get the flu, they get these same symptoms I just kind of routed off, but they're able to kind of sleep it off, drink some orange juice, take a day or two off, and then they're okay. But it's the people who aren't okay, right? It's the older people, younger people who aren't okay, who end up seeing, someone like me in the hospital. So what we're seeing now, especially with the coronavirus, is that we're seeing a lot more people, right, end up in the hospital, end up in, our ICUs, end up on, respiratory, lung, all of these like end stage related diseases, because it's really hitting home. Because we, especially from a global standpoint, have never experienced the coronavirus really affected on a global scale, right? It's affected certain pockets here and there, but as far as a global scale, we have never seen this, right? So again, this is what, and I talked about this about a week or so ago, that the coronavirus is really going to be a huge public health standpoint, right? Which is why I made sure, especially in this talk, to talk about why is this a public health crisis, right? Is it a medical crisis? Sure. In the sense that, yes, it's a new virus. A lot of people are going to get sick. Or some people are going to die, right? So that's with the flu. That's with most diseases. But understanding that the rate of spread and how quickly it's spread, and the fact that we just don't know, right? This is a new player that we are not fully aware of. That's really kind of running the show and causing some problems here. So as far as the spread, because this is a very important topic as well too, because again, this kind of goes into the fact that, you have people who are hoarding all of these supplies, right? Hoarding. Again, I work in a hospital, and you know what we have to do now? Like, for me to get a mask to go see one of my patients, right? I have to like go in the back of the desk, right, to ask for a mask, right? Like they were rationing masks out because of the shortage. Now the shortage, that's a twofold street, right? Again, we can quickly deviate. A lot of our mask and products, those nature, guess where you think they're manufactured, right? In China, right? So again, when they have a global crisis like the one we're having, of course, supplies are short, and then hospitals, even like my own here at Wellington, become affected, right? So again, that's how the global economy works, right? Something can happen way on the other side of the world and affect a place like Wellington, Florida, and that's kind of same thing with the IV bags. If you remember when Puerto Rico got hit by that hurricane, for those who may not realize that Puerto Rico is a major manufacturer of IV normal saline solution. So if one of the major sites of IV bags get hit with a hurricane, all of a sudden the rest of the country, right, can't get IV solutions. Like same thing's kind of happening now in that sense for the coronavirus. So how's it spread? Because this is what got people going crazy. So in the flu, the setting of the flu, typically we know flu is considered a droplet type virus in terms of spread, which means if I'm coughing, if I'm even talking, right, spitting, maybe, I don't know, right, but if I'm in your vicinity and I'm doing those types of events, I can have the chance to spread it to you. But that's usually it, right? Because typically it occurs with the flu is I cough and then the particles kind of fall to the ground and that's it. What we're seeing with the coronavirus is not only can I talk, right? Not only can I cough, not only can I do these things that allow, millions of particles, right? Again, we're not being hyperbolic, right? Millions of particles that kind of spread through the air, kind of linger on and then attach on somebody's face. But we're also seeing that now those particles can land on something, right? Can land on the door, can land on the phone, can land on objects, and then I touch said object, right, and then get it as well too, right? So again, some stark differences that again we continue to see with this virus, right? Again, there is unfortunately multiple ways for this virus to cause an issue, and it's definitely causing said issue here in the United States, right? And this is probably one of the biggest issues, especially here again. As a public health official, the problem that we've had is the fact that our testing has been very slow. And again, I'm going to show you a kind of a CDC topic as far as CDC website as far as just some of the number of cases right now. As I speak, in fact, let me see if I can pull this up. Pull this up for us. Cases in the U.S. Give me a second. All right, so you should be able to see that. So as I pull up what we're seeing here in the United States, right? So as we speak, or as you're watching this video, right, we have about 938 cases here in the United States. And this site, again, I will put this link in the show notes, but again, it's really CDC. If you can only choose one spot, right, to get your information on the coronavirus, and chose the CDC because one, they're usually the most updated as far as numbers, right? Again, this is updated on March 11th again, and they usually update around 4 p.m. So this number is going to change, right? So as we speak, as I'm speaking, about 938 cases with about 29 deaths. I can tell you, and again, we'll talk about it a little bit more with the public health standpoint. I can tell you this number is a lot higher, right? And I can tell you the reason why this number is a lot higher because here in the United States, we have done a terrible job at being able to diagnose people. Really, because we don't even have the ability to diagnose people, right? Like we don't have the testing, we don't have the ability to testing, we don't have the availability. It's not quick enough. We don't have that availability to test like other countries have been able to test, right? So this number here, yes, it says 938, looks good, right? I can tell you right now, again, mark my words, this is March 12th. By the end of this month, right, wouldn't be shocked if it goes, between 5 to 10,000, right? Like, because that's what's going to occur. Because you're going to start seeing this huge uptick in people actually being able to be tested for this. And once they're able to be tested, then we're going to see these numbers kind of shoot up. So that's kind of what's happening here, right? Again, 938 cases, about 29 deaths. You can kind of see 700 of these, about almost 800 of these cases are under investigation, right? So they don't even know how they got them. They assume it's travel related, they assume it's caused, but they're not even sure, right? Just to kind of give you some good numbers. And again, you don't have to, you don't even have to see what the numbers are. You can kind of tell, like, hey, the ones that are darker color are a problem, right? So you can see this Washington, there's Oregon, and all this even California, right? Problems over there. New York, 173 reported cases, right? Again, well-traveled states seem to really, really be affected by what's going on here with the coronavirus. And again, like I said, this is kind of where it originated from, Wuhan, China. Again, like I said, and then you have a lot of people who are on that cruise ship who were isolated, unfortunately developed it as well too. And that's a whole nother discussion as far as being on a cruise ship, but we won't talk about it here, right? So again, this is definitely a good site to go to, right? But again, I just want us to kind of think about this number here, 938 on March 12th. And I want you to kind of replay this later on, down, let's say the end of this month, right? Just to kind of see how quickly this number is going to jump. So let's stop right here. So that being said, right? So again, I think the question I get, right? Like, is it as bad as the flu? And really the answer is no, right? Like the answer is definitely no. One, because we're not even familiar with the severity. We don't even know how bad it's going to get. Like I said, we are literally in the beginning process, what is considered a pandemic. And like I'm actually going to show a video here in a second as far as kind of like the association with the pandemic, what that even means. But we're just in the early stages of it, right? So we haven't even gotten to that point, where it could be as bad as the flu, right? And the flu, again, I always talk about the flu a lot, because I think a lot, especially in this day and age and 2020, I think a lot of us downplay how bad the flu is, right? So it sounds crazy when people like me and other health professionals, physicians are like screaming at the top of their lungs, like, hey, you should get a flu shot, get a flu shot, get a flu shot. I don't think a lot of people remember, and you're probably not, right? In 1918, right, we had a flu pandemic as well, just like we're having a coronavirus pandemic. Do you want to know what the numbers of deaths? We're going to just talk about deaths, right? When it came to the flu at that time in 1918, it was about, just in the US, Americans, about 675,000 people died from the flu, right? Again, that's 1918, right? 675,000, 50 million worldwide. Right. So again, and I think a lot of us, because we forget that, right, because it's usually not in our, our immediate psyche, right? That's why we downplay the flu, right? And what I love, right, again, I think one thing I chuckle on the inside, right, is because I don't see a lot of people, right, telling me that they don't believe in the coronavirus, right? You see that a lot with the flu, right? A lot of people tell you, I don't believe in the flu. Flu isn't, like, you're not hearing none of that talk now, right, when it comes to coronavirus, right? So again, people are definitely taking this coronavirus serious, right? Again, they're buying up the toilet, for some reason they're buying the toilet paper, right? They're stocking up because they're not sure what's happening, right? So at least in some sense, we have more people taking this virus serious. But again, I don't want to downplay the flu, right? Again, I saw some people kind of pointing to the numbers of people who are going to die from the flu, right? And I've talked about it as well. A lot more people, trust me, a lot more people are going to die from the flu, but that's because a lot more people will be diagnosed with the flu. And the same thing that's going to happen with the coronavirus, most of the time, right? Again, about 70 to 80% of the time, you only have mild symptoms that you don't even, it gets brushed off, right? Like, I got a cough, I got a cold, let me take some Tylenol, kind of keep it moving, right? The majority of the time, those people are never even going to be tested. Right. So we're in the initial stages, right, where the people who tend to get tested for the coronavirus are very, very sick people. So if I tested very, very sick people, just think about those numbers. If I tested very, very sick people, you best believe a lot more people are going to die. But I think especially once the U.S. kind of gets their act together, right, and understands, like, no, we gotta, like, test everybody, like, as much as people who can, because from sheer hysteria alone, a lot more people are about to be tested, right? Everybody wants to now get tested. I got residents who, if I get a cough and cold, should I stay home? Like everyone's going to be concerned and want to get tested, right, if they experience anything, right? So we're going to see the number of people, right? Again, that's why I talked about that 938. We're going to see that number jump dramatically once we have some type of process and system to be able to, adequately diagnose it, right? So what we're hoping, right? What we're hoping is that once we see that number of people who get diagnosed and tested, we're hoping that mortality rate, right? Because that's the big thing, right? We're hoping that mortality rate does not also increase as well, because that's really where you're going to see a lot of people die. Like I said, 1918, the flu, the one that some people laugh at, right? Killed 50 million people, right? So again, and it killed 675,000 people here in the U.S. So again, it is definitely nothing to play with. Again, I'm not saying that the coronavirus is in that instance, but I can tell you that as we go and as our testing becomes much more available, because right now, like, even if I wanted to test myself right now, the amount of steps I would have to go through and prove that I should be tested, I want to get tested, right? So that's, again, I'm a health professional who takes care of patients here in the hospital, right? So just to kind of give you an idea how difficult it is to even be testing people in the first place, right? So that being said, so here in the U.S., right? So here, as far as coronavirus in the U.S., I want to show a video, right? Because as of last week, right, this wasn't even considered like a global epidemic, right? So this is a video from the WHO director, right, who's talking about the coronavirus. All right, so let's get this video together. All right, so I got a comment that maybe we might be able to hear that video. If not, I'll make sure we have that video out in the links as well for us. But like I said, it's essentially, again, this is the World Health Organization. These are people who kind of go over, disease process across the whole wide world, right? And here he's kind of proclaiming like, no, this is a pandemic. This is, and for those who may not know what a pandemic is, right? This is a disease process that has now spread globally. Right, this is not something that's just localized here in one sector, one country. Right, no, this is a global disease process. Again, if you've caught some of this news, right, you understand that you have countries that are shutting down. Again, if you caught the news, right, you have sporting events. Again, the NBA, right, the NBA like suspended their whole season. You have college sports that aren't allowing audiences there, right? You have sporting events essentially being canceled. So this is something that, again, first of all, I, as a public health professional, I am extremely happy that that's occurring, right? Because that's really the only way, right? Especially in the initial stages, that you're able to, kind of contain, right? And I hate the use contain because it's everywhere, right? Like I can tell you right now, there's not a place in the country that does not have the coronavirus, right? So this is not a disease that you're going to be able to kind of isolate and keep in one certain area. for that standpoint there. But it is something that we really, really have to be very mindful of, because now that we know it's everywhere, right? Like the question, right, that I'm getting is like, what can we do about it, right? Like now that now that the current, I'm in Palm Beach County, right, and I know there's already some cases in Broward County. I already know there's cases in Palm Beach County. We just haven't diagnosed it yet. If we have it, it's going to happen. What can you do, right? Again, we talked about how it spread, right? It spread via droplet. It spread some via contact, right? So again, do I want you guys buying up all the gloves and masks? I do. Like, we had people in this hospital, right? We're not gonna call no names, right? We have people like stealing the gloves, right? We have people stealing gloves that and that's why we had to hide them in the back of our nursing station, right? Because you have families stealing masks, stealing gloves, to take home. Again, if you are young, right? Like if you are young and healthy, this is a disease that is not, and for the majority of people, not going to cause any significant issues, right? But just like the flu, right? And again, we've talked about this before. Just like the flu, the people who get affected by the flu and a lot of these disease processes are the people who are going to be more likely affected anyway. So these are our older individuals, people who have disease comorbidities that make them at risk, right? So right, I saw some report that talked about obesity being one, diabetes being one. If you have any lung related issues, aka my smokers, right? Again, for those who this might be your first time watching my video, you know that every chance I get to say stop smoking, I tell you to stop smoking, right? And here's another reason why, right? Because if you're a smoker, you will also add an increased risk for that's very good. I'm going to come to the comments at the end of the video. Every chance I get to tell a person stop smoking, I tell them stop smoking, right? And this is another reason why, right? Because you're going to be at increased risk for ending up with the coronavirus, right? Not only with the coronavirus, but end up in our hospital setting, right? End up in the ICU, right? Because your lungs are not going to be able to deal with the effects of said virus, right? So this virus is here to stay. Like again, we are just in the initial phase of it, right? And again, unfortunately, here in the U.S., because we were terribly slow for lots of different reasons, terribly slow at our response. We're already behind on the 8 ball, and being behind on the 8 ball unfortunately is going to cost a lot of people a lot of lives, because you're going to have a lot of people who should either be quarantined or should be safe, like we're not going to even know because we didn't test them for it. We couldn't test for it. Like I said, I couldn't test myself right now if I wanted to, right, because of all of these stringent criteria. I think once that opens up more, that's when we're going to have to kind of deal with that aspect, right? So we're dealing with two different phases of dealing with the early stages of like disease, right? Again, we shouldn't be shocked that they're shutting down these sporting events and conferences. We shouldn't be shocked because that's what you would want to happen anyways, right? But what we should be shocked and concerned about is what is going to be our response moving forward. Is this going to be like the pandemic of 1918? I doubt it, right? We have our healthcare system is much better for some, right? That we should be able to contain it so we don't have 675,000 people die. Again, 1918, the flu, the one that people don't believe in, right? We shouldn't have that happen, but we are going to have a lot of people sick. And as a health professional, as one who works in a hospital, the biggest concern that we have, right, is like, how do I deal with this huge influx? Like, mind you, we are still in cold and flu season. Cold and flu season is enough to put a lot of people in the hospital, right? Cold and flu season is enough to keep people in said hospital. So if cold and flu season was enough to keep our hospitals busy, imagine now you add this pandemic virus, that coronavirus, COVID-19 is, right? So definitely some concerns for especially kind of moving forward. I felt it was kind of needed because if you're in my private Facebook group, we've talked about this kind of in the beginning, right? We've kind of talked about what do we do as far as this virus. Again, it's really about educating, right? And not being I don't want us to be desensitized by the amount of information that we're getting, right? Because we are getting a lot of information every single day. I want to make sure we put this in perspective, what we're dealing with, right? We're dealing with a virus that, even scientists have no clue about. Again, there's not going to be any vaccine anytime soon. And again, and even if there was a vaccine, right, just judging by what people typically do, especially here, at least here in this country, how many of y'all would actually take it, right? Like, that's probably a good question, right? Like, if I had a COVID-19 virus right now, would you actually take it? And if you would actually take the COVID virus 19, why aren't you taking the flu shot, right? So again, yes, the vaccine is underway, but when we say underway, we're still talking like a year or two out, right? So we should not be looking for that. We should be dealing with just our supportive care, because even if I test for the virus right now, I don't have a medication to give you anyway. There's not a medication I'm going to give you to help treat your COVID-19. No, I'm just going to be able to just kind of, really in the hospital, tender love and care. If you need help breathing, we got a machine for you, right? If you need some food, we got some IVs. But everything is supportive care, even if you get diagnosed. So that's why we're trying to quarantine people, keep people, where they need to be. And as a public health professional, I do worry. Let's say they start closing schools down, right? Let's say they start saying, people stay at home, right? Well, what are we going to do for our parents, right? What are we going to do for our parents who have to work, right? And if now they got to stay home to watch kids, right? If they can't work, right? How do they pay the bills, right? We've seen in different countries, we've seen a response to different countries, right? You have, mortgages being suspended. Some of you may already start receiving emails from some of your billers saying, hey, we understand, contact us. Like, please take advantage of it, right? Because it's probably not going to be across the board, right? It's probably not we really are going to be looking, especially from a public health perspective. I'm going to be looking at a lot of the companies, especially these mortgage companies, these banks, and all these other places here to see what they're going to do, right, to help the general population, deal with the fallout effects, right? Because when a conference gets canceled, right, people can't work on the conference, right? When games get canceled, right, people can't work for the games, right? There's going to be a lot of financial issues associated with the disease, right? As you can see, again, if you're in the stock market and you got like a 401k, I probably wouldn't even look at it right now, probably for the next month or so, because it's going to hurt your heart, right? Don't look at it. Don't do anything crazy, but that's what we're dealing with now, right? It's definitely info that it's going to be a concern. And here, as me, especially with Dr. Barry, I'm going to make sure I try to talk to you guys at least every couple of weeks, just to kind of update you, so to try to quell some of hysteria that I know is out there. Like I said, I'm watching it, I'm informed, and I know that if I wasn't as informed, I'd probably go crazy too, right? Which is why we wanted to do this here on Facebook, on YouTube as well, right? Depending on wherever you're watching it. I'm just kind of looking at some of the comments before I go. And like I said, so I saw a comment as far as the value networking. I'm definitely going to make sure we post that WHO video in the Facebook page so you can watch that later on. Again, I am at Dr. Barry Pierre /Facebook, and you'll get to my Facebook page. This is a good question. Should hospital restrict visitors from coming into the hospital? Right? You know what? That's a very interesting concept, right? Should we stop people from coming into the hospital? The problem is, right? And again, I don't want to say it, right? But we gotta be honest with ourselves, right? We probably got some hospital workers who will likely already have the coronavirus as well, right? So, yeah, I can stop the visitors, but you got people who work here, right? Who are gonna, again, I'm not saying here as in Wellington, because I don't want y'all to run away from Wellington, right? But you got people who are working at hospitals already, right, who likely have a disease. Again, yesterday they canceled the NBA game, right, because one of the NBA players was diagnosed with the virus. And quick side note, right? The amount of HIPAA violations that I'm seeing kind of go out is absolutely crazy. Again, I understand if I sprain a knee, I break an ankle, you tell me, but if I have a communicable disease, I probably don't want you telling the whole world before I get a chance to tell my people, right? But yeah, not only does he have the disease, right, but then I guess another one of his teammates tested positive, right? So again, so people are being quarantined. This is here, right? This isn't something that maybe coming in the near future. No, this is here right now. We are starting for it. I just hope that the the upswing is what we're hoping for is that the upswing, especially when we start being able to diagnose more people, doesn't also increase the rate of mortality, right? Mortality rate for the flu is about 0.1, right, to 0.3, right, give or take, right? So again, yes, we have a lot of people get diagnosed with the flu every year. A lot of people get diagnosed with flu, just so in case y'all are unaware. A lot of people get diagnosed with flu. A lot of people get treated for the flu, and there's a good amount of people who die from the flu. That's going to happen. The same thing is going to happen with the coronavirus. A lot of people are going to be diagnosed, right? A lot of people are going to get sick and end up coming to the hospital, and there's a lot of people who are going to die. Now, the number of people who get diagnosed still isn't going to touch the number of people who probably likely have it. Why? Because again, for 75 to 80% of people, nothing, it's a common cold for them. They don't even realize it, right? Because again, common cold, coronavirus, and flu, like it kind of presents the same way, right? So understand, of things to come, right? So when you start seeing some of these numbers in the media, like, oh my God, 10,000 people have it, 100,000 people have it, 200,000 people have it, right? When you start seeing those numbers, because you will, right? When you start seeing those numbers, I don't want you to be alarmed. Just understand from a public health perspective, that just means that we're finally getting on the ball and actually diagnosing people who have it, right? Like that's all it means, right? The number we are concerned about is, all right, out of all of the people who get diagnosed, right, how many people are not living, right? Like that's a huge number, more than anything else, right? Again, I've seen people mention SARS. I've seen people, for example, I don't know if people realize, because I saw someone, post something, I think it was on Twitter, about the H1N1, right? I don't think people realize H1N1 is the flu, right? Again, it's just one of those things where, again, when you don't know, right, as a public health professional, like, no one says I don't believe in H1N1. No one says I don't believe in SARS, right? But the flu, unfortunately, and again, I'm a flu proponent, right? Because I think everybody should get, like, we only give the amount of people who should be tested for the flu is about who should get a vaccination. Our success rate is only about 40%, right? Just to give you an idea of how not of a good a job we're doing. So that's why I don't believe having a vaccine for the coronavirus will do anything, because we'd likely get that same percentage of people who do the vaccine, right? Again, the anti-vaccine folks are very silent right now, right? But they're buying up all of the products, right? They're buying up the toilet paper, they're buying up the hand sanitizer, they're buying up all of these products, right? But they're very silent, right? Because again, when stuff gets real, right? Like all of a sudden people's like start actually doing what they're supposed to do. So that's neither here or there. Again, I appreciate everyone who's watching this on Facebook or YouTube. Because again, I think this is a huge important topic that I think really needed to be addressed. And I was seeing so much misinformation that was being put out there. I said, all right, let me just because again, I've been talking about this in my private group, right? But I said, all right, let me just like let the public know what kind of is going on. So y'all be easy. Like I said, we are going to, again, as a health professional, we are watching closely. As a public health professional, we've been kind of eyeing this. Again, this is something that we're going to have to come together here in the United States. Again, we've dealt with this before, right? We've dealt with Zika, we've dealt with Ebola, we've dealt with this, right? But I can tell you, this is a different monster, right? So just so I don't want people to downplay, like, oh, Zika came and went, or Ebola came and went. Like, no, like this is not going anywhere. This is actually just kind of starting, right? So again, not too long talk, you guys. Y'all be blessed. Again, wash your hands, right? Again, that's if you don't take nothing from this, right? Just wash your hands. Wash your hands, right? Try to be as healthy as you can be, right? And again, understand that, again, find either a local health department or your primary care physician. Those are the people who are going to be on the front lines, right? Because those are people who are going to get bombarded with a lot of, hey, I got these symptoms. Is this corona, right? Those are the people who are going to get hit, right? So I'm praying for them because I know once they come in the hospital, they're gonna hit us, right? Again, everyone in the hospital now thinks they have corona, right? So these are some of the questions that we're gonna have to field. Again, there's a lot more people who will be talking about this in the near future, and I hope, especially at least on the podcast front, we're working on trying to get an infectious disease specialist to kind of go into a little bit more detail on the coronavirus that we need to kind of go through here. So y'all be blessed, be easy, have a great day. And again, thank you for coming. Episode, I think, 69 of the Empower Yourself for Better Health series. I'm gonna see you guys later. Bye.